I'm sorry, Ruth is not here to tell her story because she was a wonderful person. Good scientist, fantastic mother. Really, she took care of 3 children. All of them succeeded in life. She was a great lady, so strong-willed. When they arrived in Brazil, her parents were doctors, but they could not practice because they had to go through exams. So they bought a brick factory, very far from the center of São Paulo.
Austria, after the First World War, became a tiny country. I was barely 7 years old when I left. My father was put in prison as soon as the Nazi entered. But my father helped a Nazi. One day, one of these Nazis, from the time it was illegal, whom my father had helped, the guy said, I take you and your whole family to whatever country you want by plane.
Her father, who didn't like me and vice versa, wanted her to be a nurse. She said, to hell with you, I want to go to medical school. I met Ruth for the first time in the oral exams to enter the medical school. The medical school in São Paulo was very strict, and to enter, there were more than 500 candidates and 80 places. Mm-hmm. Very quickly, we became friends because we were on the left. Ruth, very independent woman always, very independent. We were dating already, but she said, I have to go to Austria, back. That was 1939, the end of Second World War. She wanted to see whether she could continue her studies in Austria, not in São Paulo. Mm-hmm. So she started disobeying her father, and the second, she didn't care about me too much, went back to Austria. Alone. The medical school was completely different. She was very disappointed. Mm-hmm. And she decided, no, and went back. Brazil was, at that time, ruled by the military. Mm-hmm. We were both against the military. We discussed seriously, do we want to change the government and do subversive activities or communists or whatever, or do we want to do science to find new therapies or new stuff? We really discussed this. We were silly, but idealists.
Mm-hmm. That's not silly.
And we decided that we want to do science. We wanted to do something, not to stay in São Paulo.
They were on a fellowship in New York when a military coup in Brazil forced them to stay permanently in the United States. There they worked in laboratories a few blocks apart, and there the real breakthroughs happened.
Malaria is a disease caused by tiny, single-celled parasites carried only by a certain type of mosquito.
Dr. Nussenzweig's extraordinary contributions forever changed malaria vaccine research. At a time when it was thought that a malaria vaccine was impossible, her work with her husband and collaborator Victor Nussenzweig showed otherwise, paving the way for today's malaria vaccine efforts.
Opportunistically, I abandoned what I was doing and joined her because I noticed that was more important than what I was doing. So, and that I could help her.
Mm-hmm.
So we paired and did research together.
I was honored to be Ruth's first graduate student to complete his PhD. My enthusiasm, coupled with her enthusiasm, really helped us move forward in so many different areas, and she never stopped me from trying anything that I felt was valuable to test. The best thing I can say about her is I started out as her student, so she was both my advisor, my mentor in the long term, and ultimately a colleague. And the one thing I said in my acknowledgments in my PhD thesis, her contagious enthusiasm was something to behold, and I will miss her very much.
She was deeply committed to help poor people living in malaria endemic area. For Ruth, science was a tool for social change that should help improve the life of the underprivileged and poorest people.
Ruth was the person that first believed in me as a scientist and gave me a chance to have my own lab. She was incredibly nice because just after talking to her, she told me, get started. You don't have to report directly to me and tell me everything you're doing, and just do whatever you think is important. And I think that sentence says everything. She didn't tell me whatever will give you better publications or more grants. She just told me whatever you think is important. And I think that's the way she took science, and I have really tried to follow that advance during my career.
I want to celebrate today her memory with the two lessons she taught me. Never give in, always give chances. She was always ready to give suggestions not only on the experiment, but also on the future career of the people she was working with, even if they were not her people and would not have worked on malaria.
Ruth kind of fulfilled the American dream for me because I came without really a big CV, and she kind of launched my entire career because at the time I was actually ready just to be briefly in New York and then go back to join Robert Ménard's laboratory. I want to really thank Ruth, and I greatly appreciate that she believed in me, even though my CV was far from being presentable.
There are two things about Ruth that really stand out for me. The first is that she did her groundbreaking work at a time when most women were not working outside of the home. At the time, she was the only female department chair at NYU. She ran a department and a world-class research effort while concurrently having a second full-time job, namely raising a family. I never knew how she did it all, notably without complaining, and she's really been a role model for me and for other women in science. The second thing I wanted to mention was Ruth's laser-like focus on the problem she chose to pursue, namely making a malaria vaccine. Her work led her to understand that the pre-erythrocytic stages of the parasite were a good vaccine target, and she pursued this line of research even when the malaria community was not ready to embrace this. Indeed, she had the courage to persist despite the sometimes very loud criticism. In the end, she was right. Targeting the pre-erythrocytic stages by subunit or whole parasite vaccine approaches has generated the only malaria vaccines that have demonstrated efficacy in clinical trials. And Ruth, through her work and the courage of her conviction, had a seminal role to play in these milestones.
Not only did the breakthrough bring money into the field, it also started other scientists around the world on the hunt for a malaria vaccine.
The most two advanced vaccines for malaria are based on her discoveries in different ways. So one that is already approved in Europe and is going to be used in pilot. It has shown partial efficacy, so it protects children in between 30-45% from malaria, and possibly protects even a lot more from severe disease.
It was a dream of both my parents' lives to be able to do something for human beings suffering from this disease. And so even though the vaccine may not be as efficacious as she would have liked it to be, one of the things that she was extremely proud of is that it is saving the lives of children.
End of the story is that I miss Ruth a lot, a lot, a lot.